What is stage 1 esophagus cancer? Here are some additional details about stage 1 esophageal cancer. Subtypes. Esophageal cancer can be broadly classified into two main subtypes: adenocarcinoma and squamous cell carcinoma. Adenocarcinoma often arises in the lower part of the esophagus and is frequently associated with conditions like gastroesophageal reflux disease GERD and Barrett's esophagus. Squamous cell carcinoma typically develops in the upper and middle parts of the esophagus and is often linked to risk factors such as smoking and heavy alcohol consumption. Diagnosis. Stage 1 esophageal cancer is typically diagnosed through a combination of imaging tests such as endoscopy, CT scans, or PET scans and biopsy. During an endoscopy, the doctor can directly visualize the inside of the esophagus and take tissue samples biopsies for analysis under a microscope. Imaging tests help determine the extent of tumor involvement and whether cancer has spread to other parts of the body. Treatment options. Treatment for stage 1 esophageal cancer is aimed at removing or destroying the cancerous tissue while preserving normal function as much as possible. Treatment options may include surgery. Surgical resection, such as esophagectomy, involves removing the portion of the esophagus containing the tumor, along with nearby lymph nodes. Minimally invasive techniques, such as laparoscopic or robotic-assisted surgery, may be utilized when appropriate. Endoscopic resection, for early-stage tumors limited to the mucosal or submucosal layers of the esophagus. Endoscopic procedures such as endoscopic mucosal resection (EMR) or endoscopic submucosal dissection (ESD) may be performed to remove the tumor. Chemotherapy and radiation therapy. In some cases, chemotherapy and/or radiation therapy may be used before or after surgery to shrink the tumor, reduce the risk of recurrence, or improve surgical outcomes. Prognosis. The prognosis for stage 1 esophageal cancer is generally more favorable compared to more advanced stages of the disease. With appropriate treatment, many patients with stage 1 esophageal cancer can achieve long-term survival and may be cured of the disease. However, the prognosis can vary depending on factors such as the subtype of esophageal cancer, tumor size, grade, and individual patient characteristics. Follow-up care. After treatment, patients with stage 1 esophageal cancer will require regular follow-up appointments with their healthcare team to monitor for any signs of cancer recurrence or treatment-related complications. Follow-up care may include periodic imaging tests, endoscopic surveillance, and evaluation of symptoms.